widening the gap between holistic care and traditional medicine for seniors. So this is what my talk is about. What is holistic care? How can it come alongside traditional medicine for seniors? Is it still possible for them to get holistic care? It certainly is. So I'm super excited about that. Can everyone hear me at the back? All right, thanks. Let me know if you don't. So I'm going to start here. This is my dream team. They're in the back here, and Florence is in the front. I'm really excited to have such a great team. They're big ambassadors in what we do and how we educate our patients. Holistic health is a whole body approach, and it can be full of education. And it's really difficult to educate our patients, and we really rely on an amazing team to do that. This is my practice here, right here on the bottom. Like I said, I've been actually in the alternative and traditional healthcare model for the last 30 years. When I was at the hospital, I didn't last long in the OR. I worked for an orthopedic doctor. I saw a hip replacement, and I just felt passed out. I'm not good with blood, so I knew my career as being a surgeon was just null. And so I went through all the different departments in the hospital. I went through rehab, physical therapy, occupational therapy, and landed in speech language pathology because I really enjoy the fact that you could, follow a patient through and measure their progress and measure their success in healing an injury. So I felt like, hospital setting is great, but I really want to be a clinician. I really wanted to get out there in the community and really have a wonderful relationship with my patients. My big health dilemma actually was when I was in university and I was working as a lifeguard in a 1-acre outdoor pool, and I was on my lifeguard tower. I sat there and I started to feel pins and needles all over my body. I was like, this is weird. I could fall asleep on my leg or my arm, and then it started getting worse and worse. I was like, what is going on? So I called for backup, got off my tower, and I knew I had to go straight to the emergency room. I knew something was terribly wrong. There, the surgeons, they pulled out my spinal fluid through an epidural. If anyone's given birth to children, you know exactly what that is. Another needle gauge that I was like, oh boy, I can't do that. And they pulled out the cerebral spinal fluid, and when they looked under the lab, they were able to see that I had a high protein elevation in my cerebrospinal fluid. So something was going on with my nervous system. There's a whole bunch of antibodies, and they were attacking my myelin. So those are the conducting pieces for your nerves that send messages out to your body. So I was like, wow, what does that mean? And he's like, you have Guillain-Barré syndrome. I was like, what? My brain was basically saying, I can do everything, but my body was disconnected. I couldn't seem to move my arms, and it was getting worse, and then they were measuring my respiration to see if I had to be an intubator. I was like, what? This is crazy. So it's a peripheral nervous system disease, and my neurologist was super helpful in explaining it to me. And he asked me, what did you do that might have caused this? I was like, well, 2 weeks ago, I had Campylobacteriosis food poisoning. So I ate something bad, and I was really sick. I couldn't go back to work. So he's like, well, what happened the day or two before you actually went back to working as a lifeguard? I'm like, oh, I went to the doctors, and I got cleared to go back to work. And just as the doctor left, the nurse came in, and she's like, oh, by the way, while you're here, you're due for a booster shot. I was like, oh, okay, sure, no, whatever. My mom was with me. I was 21, totally legal to do my own thing. I was like, sure, whatever. And that was the next day. My neurologist said that's exactly probably what happened. Your body was already sick, your immune system was amped, and then you had another chemical insult that just amplified your response, and it affected the nervous system. I was like, wow, super cool. Super grateful that it didn't get to the point where I couldn't breathe. I was very fortunate. But that's pretty much how I started to love the nervous system and understand the importance of having good nervous system health. My neurologist was great. I don't know if any of you have been unable to walk or move. You actually start to atrophy your muscles. You can't, like the amount of time you're out for 3 months, I was out for a good 3 months. it took me another 6 months to get my muscle strength back. And my chiropractor was the one that was really able to help me with that. So it was a long, long journey, but my neurologist and my chiropractor always communicated, and I fell in love with both of them because they're a great team. And I was just like, this is great. I love these two talking heads in my court, and they're really helping me get better. And they really just kept saying, you know what? All you need to do is put yourself in the right environment, and you'll heal. So I was just super stoked. Now I know that's not the same for everybody that has this nervous system disease. Those are peripheral nervous system disease, and I was grateful that I learned so much from that experience. So that's just a little background story about me. I have been the patient, and I'm going to now. So I knew my career path was pretty much solidified at this point. Going to be a chiropractor was a no-brainer. Okay, so this is my mom. I have parents. I'm lucky they're still alive. I have a 76 going on 16-year-old here with my mom. She's great. My dad is still alive, and I'm grateful to have them. But this is me now being a caregiver for something that didn't tragically happen, but this was an unnecessary accident that happened that couldn't be avoided. But my mom, I got a phone call in February, and my dad said to me, Cynthia, I just hit your mom. I'm like, what? What do you mean? What do you mean? With the car? I was like, oh my gosh, is she alive? Like, what's going on? And he's just like, no, she's going to the hospital right now, but I think I might have broken her leg. So they were going and picking her up. He reversed in his driveway, and the lights weren't working, of course, and it was really hard for them to change the light. So instead of my mom getting out of the car and going in front of the car like she typically does, she went behind the car and tried to help my dad back. And unfortunately, he didn't look the way, he didn't see her going, they didn't communicate. And she unfortunately broke her femur right here, you can see. So now I'm used to actually helping my patients get through femur fractures. It's one of the biggest bones in your body. It is a life-threatening event if you actually sever your femur artery. The femoral artery is right there. This has a lot of bone marrow, a lot of immune system properties in there, so it's a big bone. The night that she got there, again, I'm talking, it's so hard to be far away from your parents, especially in a traumatic situation like this, and I'm now the caregiver. I'm not just a doctor, I'm the daughter. So that was really hard for me to be actually in that situation. So my mom is in the hospital with my sister, and I'm getting broken information, and they're basically saying, I'm sorry, we can't do emergency surgery, we have to traction you. We don't have enough doctors to do it. So she waited another 24 hours. At that point, my brother had to step in and really advocate for her to get the surgery completed. So I'm just trying to highlight, again, why we're all living a human experience right now. I'm just showing you a little bit about my background, being a caregiver in this situation, and my mom falls in that senior category, and how hard it was for me to get information, advocate for her. But there was a lot of problems that went on day after day. I don't know if you guys know this, but when you have a femur fracture or a hip prosthesis and you're doing the surgery the next day, they get you moving. You have to get up. It's really good for those muscles to start moving and the joint to move. But she kept saying, I've got to sit down. I don't feel safe. I'm actually feeling like I'm going to fall again. So now she's got 20 billion fall stickers all over her. Every day she's saying, I can't do this. I feel like I'm going to pass out. So what do you think actually might have happened in the surgery? She lost a lot of blood. Her hemoglobin levels were following. Every day would go into the computer to see, and the hemoglobin levels were going down. So she had an emergency transfusion. Next day she felt great. She was moving again. I can do my therapy, my rehab. But then they're telling her you need to go home or you have to go to a rehab hospital. I don't know if you know this, but you actually have to go to a rehab hospital for 2 weeks afterwards. Well, she was feeling not so great about her experience, even though they had great care there. But she was just like, you know, Cynthia, I kind of want to just go home and have in-home rehab care. So I was like, whatever you want to do, Mom, I'll be right there. I've worked on my patients, well, telemedicine every night, and that's what we did. So she came home, and I saw my patients every day, and then I'd come home, FaceTime my dad, my sister, my brother, and we all worked together to help bring down swelling. So as you can see right here, when somebody has a lower extremity injury, everything cools down because of gravity. So trying to step on your foot is really difficult. So every day we were, again, just bringing down the swelling. The swelling wasn't improving at all. It was just still staying there. I'm like, you know what? I normally have seen a lot of my patients go through this. You should be here, but you're still far back. So we had another professional eye look at it, an acupuncturist, and the acupuncturist said, yes, I agree, something's not right. So do you guys have any idea what the next complication would be post-surgical for a patient? Okay. It actually, she had a blood clot in her leg. So that was the next complication. My heart kind of dropped because I know that now we can't do any rehab in her actual leg to help move the swelling, because we could dislodge the clot and it'd be going to her lungs and it'd be a medical, she could die. So that was a little heartbreaking, that news, but just letting you know all the different complications and really advocating and going through everything and really her standing up for herself and going, okay, things aren't better. That led to better answers and better conclusions and how to navigate through her healing process. Okay, so that was my biggest fear. She's doing great, by the way. She's back at work, can you believe it? And she is thriving. Okay, so today's goal is really trying to understand how we look at the body as a whole for seniors. What structural issues do most seniors have, and what are the tools to help them? What can we do with functional medicine? What are the common complaints that seniors still have that traditional medicine doesn't address, and what are the tools to help? What emotional issues are seniors going through or faced with? Not even seniors, but caregivers. I don't know who or what everyone is here. I don't know if you're a caregiver, if you're getting older. I don't know. I'm just trying to go from the caregiver role and the senior role here. So energetic, we're going to be going over some energy issues that seniors might have and what energetic tools are out there that are a little bit alternative. So you can see right here, this is a graph, and this is illness all the way to wellness. And most of our traditional medicine likes to fall kind of in here. There is a problem, they fix it with medicine or surgery. There's disability and there's symptoms, and they just here for pain relief. And that's typically what insurance will cover in the traditional model. Now, functional medicine or doctors, it could be MDs, it could be nurse practitioners, it could be chiropractors that do a whole body approach. They're kind of looking more at wellness right in here. So that's when you don't have symptoms, but you just want to, still participate in track and field. Somebody just recently said he won something and he's 70 in track and field. He's wanting to understand how he can still function, how he can have the activity level that he's used to while being later on in his years, his age. So that's basically what we look at when we're thinking of whole body health and functional health. So hopefully it'll be clear at the end of the seminar. So again, this is, a lot of our seniors come in and they actually have arthritic changes. You can see down in here, this is somebody who's normal and somebody who has arthritis right in here. Obviously, I'm a chiropractor. I do adjustments. That's a structural solution to helping relax the nervous system. You can see right here, this is what I had, the peripheral nervous system disease. It goes throughout the whole body and into your arms. That was Guillain-Barré syndrome. And then central nervous system diseases, that's like MS, Parkinson's. That's where the nervous system is for those central nervous system diseases. Now, as chiropractors, we're working on the bone. We're protecting that nervous system. And you can see there's two different divisions of the nervous system. There's the parasympathetic. That's the good relaxation, the endorphin release. Most of those nerve fibers are found in the neck and in the low back right there, okay? And then the fight or flight and being chased by a lion, that's actually the sympathetic nervous system, and that's found mostly in the mid-back. So there's a difference between the two, and when we do therapies, we're trying to relax and engage more of the parasympathetic nervous system. All right, so right here, you can see, this is what your spine should be like. So I'm going to pass this around so you can feel it, move it. There's disc spaces right in here. This is what we typically have when we're younger, and as we get older, we start to see some dehydration. So if you can pass that around, that's straight. So right in here you can see that there is equal disc spaces, right, would you say?
Yes.
How about over there? Yes or no? Right. What's the curve like here? Is there more of a curve here, or is it straight? Is it straight over there? Yep. Okay. And then right in here, this is the cerebral spinal fluid. Anything that is white is that fluid that bathes the spinal cord, and that's the spinal cord right in here. So what we're trying to influence is alignment. We're trying to help prevent degeneration by doing adjustments, and that's what we do when we try and treat our seniors and try to prevent further degeneration and keep them moving so that they can rotate their spine and stay active. So this is, somebody's got some degeneration right in here, so that's a good one. So pass that along and so you can feel it. All right. So this is what we're influencing as chiropractic physicians. So I figured I'd share this with you. A lot of people don't understand chiropractic training. And the reason why I brought this to your attention, especially for this talk for seniors, is that we are a whole body approach, but we were trained in that with our education here. So we have to diagnose, I was trained in primary care in Chicago. I actually had to do a lot of primary care work. This is research-based. We are accredited. We have accredited colleges. So, you know, that's how we get our doctorate of chiropractic. But you can see here, we have a lot of nutrition on the bottom here. It basically compares the chart for chiropractic class hours and medical class hours. So I just wanted to highlight a couple things so people can understand where our training comes from and how we deal with the whole body approach. So right in here we have anatomy 540, and then MDs have 510. I'm just going to point out the ones where we have a little bit more diagnosis. We have 630 hours, and diagnosis for MDs are 325. Orthopedics are 210, MDs are 155. Radiology, we have 360, and MDs have 150. So what's really important is people go, well, I thought you just adjust the spine and you deal with pain for seniors. I'm like, no, we actually do a whole bunch more. We're trained in nutrition and we're allowed to work on the body as a whole. And right in here we come in at 4,485 hours, and MDs come in at 4,250, excuse me. So I just wanted to highlight, now obviously MDs, they go in and they do specialized training. They do their residency, so they're going to be doing a lot more clinical hours. So it's not to say that one's better than the other, it's just highlighting all of the work that we've done to get here. Pain relief versus wellness. Most people know us to go to the chiropractor for pain relief. But again, I've just highlighted, we influence the nervous system, so we help with relaxation. So sometimes people and seniors get confused. Am I coming here for pain relief, or am I coming here for overall wellness? It could be both. So that's something to think of. There's different types of therapies. Some chiropractors are just sports, and they want to just treat you if you have pain. And some chiropractors, they have a different approach. They use different therapies. Like we do decompression. I see seniors, I see infants, I see 2-week-olds. I see the whole spectrum of different types of ages in my office, and I'm comfortable with that. But some other chiropractors aren't, so they give me referrals, and I refer out if my services don't meet my client's needs, especially senior. Okay. So just like there's different types of MDs, there's different types of chiropractors. And remember, chiropractic is an art, science, and philosophy. How I adjust somebody is going to be different than some other chiropractor down the street. It's rooted in a lot of science. It's safe. And philosophy. My philosophy is different than other chiropractors. It's really important to understand when you're trying to find that right chiropractor for your loved one who's older and has different needs. So that's what I wanted to highlight. Chiropractic and Medicare. Carlos did a fantastic job talking about that. But it is a really difficult concept for me as a physician to learn insurance, Medicare. It's crazy out there. So chiropractic, if you are a chiropractor, if you're looking for a chiropractor that takes Medicare for seniors, you want to make sure that they actually are a Medicare provider. Most chiropractors aren't. I'm a Part B provider, but there's even different types of Medicare providers. There could be Medicare HMO, so you'd have to go to a chiropractor that takes Medicare HMO. There's a Medicare PPO. So you have to understand what your parent or what you actually signed up for Medicare, and what chiropractors fit that program. And Carlos does a great job. If anyone needs any guidance in that, I'm not legally allowed to tell people what insurance they need to take, what Medicare they need to take, but I can definitely guide you to somebody else that does know more about that. Remember, if you're actually trying to advocate for your parent or trying to figure out Medicare in a different state, they have different plans. So just make sure that when you're trying to find a chiropractor for your parent in Illinois, you understand and align yourself with somebody that can give you that support in finding the right program.
I have a question with using that. I'm assuming you're probably better off if you're a Part B chiropractor, original Medicare will supplement. It would be better for you. You know?
If I supplement what?
Original Medicare with supplement. Is that better for you? You said HMO, PPO.
We just take Part B.
Okay. Yeah. Okay.
You know, I just like my office manager, Lisa over here. We just take Part B. It's so hard to like. I felt like you're paying into it.
Yeah.
You should be using it. It's so essential to help relax your nervous system and feel good. So that's just where I'm at. Now I'll explain a little bit more. You can have acupuncture Medicare providers. You can have osteopathic Medicare providers. You've paid into it. Know that these are ancillary holistic therapies that help. My mom, when she had that blood clot, we relied heavily more on acupuncture because we couldn't move that tissue. So know what other service providers cover Medicare for your loved one. Just letting you know. Advanced beneficiary notice, if you see that word, that's confusing. Let me just be clear, we have a lot of patients that are in their 70s and their 80s that actually are still coming in for wellness. They don't have pain. They're actually coming in because they know that it helps with their balance, their coordination. So a lot of our seniors really like coming in and just come in for wellness. You cannot use Medicare for that. You have to have medical necessity. By the time you're in your 60s, 70s, typically have some disc issues and degeneration. So you have to come in with medical necessity and have to have some sort of pain if you want to use your Medicare benefits. And just remember, when you use a Medicare for chiropractic, it only covers the adjustments. It doesn't cover the soft tissue work. You have to go to the physical therapy Medicare provider. So just giving you a little flavor of that. If that doesn't sound confusing to you, because it sounds confusing to me, it's definitely confusing for our parents or people that are getting older. It's insane. So finding somebody like Carlos is really helpful. Lisa, did I do okay there? She's also a really good resource as well. So I get a lot of seniors in or children from seniors, and they're like, well, what type of adjusting do you do? My mom has osteopenia. We do regular diversified adjusting. We also do activator, which is a nice little regulated impulse in here. Actually, when I was doing a little bit more research, so it's a little bit of a lighter technique, so some seniors feel more comfortable doing that, especially if they've had some neck trauma or severe degeneration. Most chiropractors are men. I didn't realize that. 75% of chiropractors are men. So people get the conversation all the time, can you really adjust me or whatnot? And I'm like, yes, force equals mass times acceleration. What I don't have with mass, I make up with speed, but really it doesn't have to be forceful adjustment. Here we also offer non-surgical spinal decompression, so that's traction. So when you have a disc bulge right in here, we get a lot of referrals from neurosurgeons that want their patients to experience this therapy first before doing low back surgery. Really helps with pain relief. It's neutral, it's gentle. We don't go very high with intersegmental traction. As you get older, you get taller or shorter. Right. Sometimes people, the only thing they really like is not that they're out of pain, but that they're taller out of pain. I find that really funny. That being said, it's really interesting how people, I have to say, a lot of pain management doctors that, refer to me, they're like, wow, you're really lucky you do what you do because I give drugs to help with their pain. There's actually a path to help change the biochemistry. So even though they might be on pain medication, this is a way to actually structurally reconfigure and help take the pressure off the discs and avoid surgery for most cases. Not all, but for most. So isn't that a better way of approaching disc pain and arthritis? So physical therapy, you can use soft tissue work before getting adjustment. It really helps relax the muscle, hold the adjustment. Acupuncture already highlighted with my mom. That was really helpful. Structural solutions. A lot of our seniors actually don't feel comfortable at home doing home care and exercises because they're afraid. That makes sense. What if they're living by themselves? So they actually just come in and sometimes like, I'm just going to do my exercises in your office. Do you mind, Dr. Z? And I'm like, no, of course not. They want a watchful eye. They want to know that they're safe. We have a massage therapist at our office. She does community chair yoga. So it really helps with balance. You don't have to feel like, you can still stretch, but you don't have to feel unsafe if you're having balance and coordination issues. We had a osteopathic doctor in our office. This is really new and upcoming for our seniors right here. I don't know if you can see this, but this is the natural force that a baby gets up and crawls. My mom did fall again in the summertime. And you know what she said? She didn't break anything again, thank goodness. She said, what bothered me is I've been doing my physical therapy, but I was laying on the ground and I couldn't get up. That's one of the #1 issues that our seniors have problems with, is we're doing physical therapy, but we're not starting from the ground up. So getting them in that primitive reflex state is new exercise programs that we're seeing huge leaps and bounds in improving their mobility and strength. So it can be as simple as learning how to do that primitive reflex. Obviously, non-weight bearing exercises, aquatherapy. Florence and I would go to aquatherapy class, and we'd see a lot of seniors there, and it was great. It was a workout for me, it was a workout for them. They loved it. Again, gravity is our biggest stress in our body. Equine therapy, I just learned from one of my patients about equine therapy, and she probably could explain a little bit more, but that helps with balance and coordination. And then also, equine therapy is that really good connection with animals. If you're lonely, it's a really great place to have an emotional connection with not a human, but an animal. Okay. So this is the second part of the pie of looking at the body as a whole, okay? So this is biochemistry health. I'm going to try and make it as simplistic as possible. And I know that my conversation's for seniors. This can be applied to seniors. It can be applied to middle-aged people and people in their 20s and 30s. But I'm just going to try and highlight here and walk through functional medicine. When I got my license, it wasn't even a word. It was biochemistry analysis. And it's actually, you have specialized training now. The last 5 years, there's been a lot of people getting IFM. It's an accredited college where you go through training. We're seeing MDs go through this. They've done all that education. They've done that residency, and they want a new way of practicing, and they're going into functional medicine. That's a lot of years. So it's basically looking at the body as a whole. They didn't have nutrition experience in their program in med school, and now they have to sit after. So just letting you know, we're seeing medical doctors have functional medicine behind their designation. So it's founded by a biochemist. His name was Jeffrey Bland. He also was he was also a nutritionist and a biochemist. And so what I wanted to show you over here is on the far left. You know when you go to your doctor, they're like, oh, here is your laboratory ranges. These are pathological ranges. So basically, if you're on the high end or the low end of that, you're either going to be medicated or you're going to have surgery, right? Do you agree? So most of the time, they're looking at that range. As a functional medicine provider, we're looking at a different range that was made up by this government college here. So this is the functional range. It's a smaller range. And if you're on the high end or the low end of normal, that can basically tell us, well, is your liver going to be in that pathological range? So can we do something, lifestyle, nutrition, nutraceuticals, supplements to help detoxify that liver before it becomes a problem? This gentleman here, he's a funny guy. Some of this is lifestyle. But he has liver enzymes that are trending up 26, 33, 40. He's up at 70, 90 here one year. So as a functional medicine doctor, we're monitoring your every 6 months, your yearly, annual, full blood chemistry panel. We're not just using the insurance model. This is typically cash rate lab, but we're able to run the full gamut and see all the systems that are feeding into your overall health. So we're able to monitor in here. So a lot of our seniors really like that because then they can have better conversations with their traditional doctors and understanding, do I need to be on this medication? Is this medication, good for me? Is it a rob Peter to pay Paul situation, or is it just a crappy medication? And there's other things that are suffering here. Any medication that you're taking, you should be supporting your liver. There's nothing wrong with supporting your liver and talking to your MD about that. Your liver takes the brunt. So that's what we do in functional medicine. We're looking at root cause, whole person approach. If you have heart disease, what's feeding into that heart? It's not just looking at your lipid panel like this. You're looking, is your thyroid functioning properly? Thyroid sets the metabolic pace for every organ in your body. Why are we looking at thyroid? How many times have I seen people have heart disease and they're on a statin and we've never checked their oxygen? They have severe sleep apnea. That affects inflammation going into your arterial walls of your heart. So it's basically looking also at the pancreas. Are you having blood sugar issues? Is that inflaming the arteries that support and pump the heart? It's a whole organ feeding into one organ analysis. I hope that's clear. So labs, history, salivary tests, I do genetic tests. Some people have seen their loved ones die at 40, die at 50, and they're like, I want to know what my genes are. I want to figure out what can I do lifestyle-wise to change, or at least feel good enough that I've exerted some sort of lifestyle change to prevent certain things. Does it happen? Not always, but for the most part, it does. So they're at peace with that, and that's what the care that we're providing when we do a full systems approach and watch them progress from year to year. Now remember, when you're going to see a gastroenterologist or you're going to see a cardiac doctor, now we know that there's functional cardiologists. So those are the people that are medically curious. They want a different approach to their practice, and those are the people that I typically refer out and co-manage cases with. So even though my seniors are taking a lot of medication and it's really overwhelming, they're still able to get functional medicine to help support them. If there's nutrient deficiencies like a statin, we need CoQ10 with that. We didn't know that. So, people are coming in for pain to see me. I'm like, well, CoQ10, you might have pain. That's why you need to supplement with it. So we can collaborate together, and that should be the overall picture and goal for our seniors and people just in general. I'm not a prescribing doctor, so I do refer out often. I've got good relationships with the doctors that I feel are medically curious. There are some naturopaths that have prescriptive power, but they can only do certain things. They're limited in their prescription, just like a dentist. They're limited in what they can prescribe medication-wise. So just letting you know, I haven't seen right now Medicare cover functional medicine for MDs yet, but I know it's been talked about. So let's be hopeful that this will help. We're seeing big changes with new physicians that are coming out at medical school. Common complaints from seniors. So the common complaints I get is, oh my gosh, I got sick and my brain is on fire. So when we get older, we lose our hormones and everything thins out. Our blood-brain barrier thins out, our gut thins out, our collagen, our skin. So my approach to somebody who's sick and they're a senior, I'm giving them lots of things to dampen inflammation to help support their brain on fire. Brain on fire basically can look like, oh my gosh, I can't think. So you really see that sensitivity in the brain with our seniors when they get sick. I know a lot of seniors have digestive issues, and I always worry about, okay, if they're living alone, are they cleaning out their fridge? Do they have a food bacterial infection? You know, what's the level of cleanliness at their home? That might not be it, but I'm just saying those are issues that we start to see with expirations, not being able to see. What are we eating? You know, what support do we have for our seniors and our children aware of that? Again, our seniors also have a lot of UTIs. Well, they don't want to drink because if they drink, they gotta go pee. They've gotta, like, you know, it's this vicious cycle. So they get dehydrated. So that's another common complaint that we have. So we recommend pelvic floor specialists. You know, we work with that often. So what are the disadvantages for functional medicine for our senior community? It's confusing. It's a lot. They're like, whoa, I don't know. Are you tracking it for me? Because I got to put this on the side here. I'm tracking. We're tracking. We're doing that work for you. And we're actually trying to help educate you. Now, the education piece takes a while, right? So this is a relationship. This takes time. It's not like you're getting a drug, you're feeling better the next day. It takes a while, all right? What we see often that helps a lot of our seniors is concierge medicine. So basically, you can ask the same question 4 times just so that you remember, because it's a lot of information. So concierge functional medicine doctors are great. A lot of seniors really like that. So we're at their beck and call for a whole year, and they just call. It's a cash service, and we help guide them, help set them letters to their primary care doctors, and just make them understand how to better advocate for themselves with their children, with their spouse. So that's really a wonderful thing. We do a lot of monitoring devices, continuous glucose monitors. My dad was pre-diabetic. I had a glucose monitor. What he thought was healthy was spiking his blood sugar. So that was really helpful for him to see. When we're having those conversations with our parents saying, do this, they're not going to listen to us, but they will if they see actual real data. We are data trackers and inflammation hunters. So that's what we do. And most other functional medicine doctors are in that. So I also get, oh my goodness, I don't think I can take these supplements because I'm taking 10 medications. Will it affect my medications? No, there's homeopathy. Homeopathy has no contraindications with any medications that you're taking, so it's really easy. I forgot to bring it. It's like this little pellet diluted plant medicine. There's accredited colleges in the UK, in Canada. I haven't seen one here, but it's fantastic. Really helps a lot of our senior community. Liquids, powders, sublinguals, I know, the gut, it's hard to digest. So those are other options that we give them. IV therapies, if you're really, really having a hard time with digestion, we send a lot of our patients down to IV clinics to get the Myers cocktail after they've had a virus to help, again, bring that inflammation down. Regenerative medicine, I don't know if you know that, they take your blood out, they spin it, they take a good part of your blood, which is the serum, they inject it back in, and it helps with collagen and cartilage regrowth. That's also helpful for our 70-year-olds that really still want to stay active, the pickleball, everything. So it's just amazing how well that's worked for them. Castor oil packs, our skin is our biggest organ. You can always put a pack over the inflamed organ, and that can help with healing. Essential oils, and we'll get too much more into this, but they're fabulous in hospice. They're fabulous in the ICU. They're fabulous because you just work in the skin of the foot. There's so many pores in there, and it helps. There's so many medicinal properties for essential oils. This is frankincense right here. I'm going to pass it around so you guys can smell it. Okay. It really helps stress too with the caregivers that are supporting. Just having that nice olfactory bulb activation can really help with mood changes in a stressful clinical environment. All right, so this is case one. I'm going to use this person. He unfortunately, his wife passed away. This is a 50, I think he's 54. So it's not a senior. My senior cases are a little bit more complicated because they have a lot of medications. I'm just going to highlight somebody mid-age here. He came in for mid-back pain because he was just stressed out. I mean, he just became a single dad, right? Lost his wife, who he loved, cherished, and he just came in for pain relief. Poor guy. I mean, my heart hurt for him. He had 50% improvement. We did 6 visits. We had, or 6 to 12 visits. There was a treatment plan. He had medical necessity because he had pain. So we came in that way into my office. And I'm like, I'm not really good with 50%. I'm on 100% improvement. So I said to him, I go, you know what if I'm missing something? Let's run the arthritic panel and take some x-rays. Lo and behold, he had a positive HLA-B27. He had an autoimmune attack on his on his spine. It's called ankylosing spondylitis. So we were able to refer him to a rheumatologist, and there he was getting medication that helped with that. But he had skin rashes. He looked like a really full of anxiety because of all the trauma and the emotional stress that he had gone through. I was like, his skin rashes haven't gotten any better since we've been treating his ankylosing spondylitis. So we ran a ton of food allergy panels. So what I found was he was allergic to everything, even turmeric, which is anti-inflammatory. I'm like, okay, he's allergic to too much. Once you have one autoimmune disease, you typically have another. So we found out he actually was living in a home that had black mold. He left the home, felt better, and he's getting remediation now, and he's seeing an actual environmental doctor. So I'm just trying to highlight the pathway to getting to less inflammation, and now he's not coming in as often because he doesn't have as much pain because of the environmental finding there. So that's one example right there. I hope that helps. Case number 2, we had a high performance athlete. He wanted to compete. He's approaching 50 and he wanted to compete against 20 and 30-year-olds. He came in 11th in an event. He came in because he kept getting injured, and to me, overtraining is inflammatory. So I always say, overtraining is inflammatory. I think you're training more because you really want to win and beat these young kids because you're like, I'm old, but I can still do this, So we ran. I said, look, I'm just chasing your injuries at this point. This guy, I was like, you're a hot mess. Like, this is not good. Let's go measure this. You don't believe me? Let's do your inflammation panel. His homocysteine level was super high at 60. His liver enzymes were 70. They should be 25, 24. His testosterone was 1,100. He's taking HRT. But is that being managed? No, it should be below 800. He's taking way too much testosterone. It's overspilling, and he now has estrogen he has to deal with. Not good. So it's a Rob here to pay Paul situation. So I'm like, oh my gosh, stop. All right, let me just scale this back. Have you ever done a liver detox? He's like, no, what's that? Okay, let's do a little liver detox. Let's scale back your training. Let's work on these inflammation pieces. Let's send you and refer you out to a medical doctor who does IV therapy and NED that helps with energy, so he can perform and still train but not go cray-cray. His inflammation markers decreased within a couple months. He scaled back. He repeated that same challenge, came in 4th. He was so stoked by doing less. So I just want to let you know, and we see this often also with our seniors. It's possible. So just give him time. It doesn't happen overnight. It didn't happen overnight. Actually, I had to convince him, showing him last, but it's all in the data here. So the number 3 part of the whole body picture is emotion. Did you guys know that the #1 predictor for Parkinson's is loneliness? Just came out in PubMed. How many of our seniors have lost their partner and they're living alone? So to me, this is something that really is important to look at. Grief. A lot of our seniors have anticipatory grief. They're waiting for the next friend to pass away. So there's a lot of grief and overwhelm that they're going through. My mom felt that she was completely invisible. When she was talking to the doctors, they're like, oh, well, you know what? You can just stay at home and not have to work. You can go and do your rehab on your own. You have all these means. No, she doesn't. She didn't. She felt very degraded and invisible. So, giving you a little bit of flavor of what I'm hearing when I talk to my seniors. Depression. I think Susan mentioned that 50% of us are going to go through what I went through, or my mom, an injury where we're down and we can't move for a long period of time. We're going to get depressed. That's just the reality. A lot of our seniors are dealing with anxiety as well because they're living alone and they're scared. Dementia, I know Ruth talked a lot about this, but what's really concerned with for me for dementia is the caregiver that's caring for somebody, their spouse that has dementia, and they're going through grief while somebody's still alive. Just remember, your worst day is somebody else's dream. It could be somebody else's dream, all right? So every day, the tool that I give my seniors and myself, this is my own thing, is just remember what you're grateful for and what you have. I deal with a lot of complaints because that's my job. I get that, because they've got health complaints, but just remember this is a tool here. What is out there for us that's alternative and different? Talk therapy with muscle work. So, doing that, we've seen greater outcomes rather than just talk therapy. We do neuroemotional technique in our office, EMDR, we refer out. The mind-body connection. We've seen somebody that was regulating their blood pressure. We're like, okay, we're going to give you 3 months. Or MD and I were like, let's give her 3 months. She did mindful meditation and she was able to bring down her blood pressure. So what was the key problem for her? Stress. Her MD gave her that opportunity to try and see if she could do it without medication, and it worked. Does that happen all the time? No. But that was an opportunity and one less medication that she had to manage because they're tired of managing so much. Exercise, volunteer work, connecting with the community. There are elders. They still have a lot more wisdom than we do. It's really important for them to be still having a need and contribution to our community and our society. A lot of elderly or our seniors don't know how to sleep. So we talk about that. My mom and dad, I'm like, oh my gosh, don't sleep with the TV on. Are you kidding me? All this blue light. Go outside. Red light. People are spending tons of money on red light therapy. I'm like, go outside. Don't be in front of the TV. So we just really get hard in evaluating their sleep habits when we do functional medicine. Pet therapy is pretty straightforward. Adjusting helps with happy hormone release. That's documented in the literature. Energy medicine. This is really, really upcoming. Oh, it's not upcoming. It's been around for years. So, energy medicine could be, some of it's regulated, some of it isn't. If it works, great. And if you get approval from your MD or your other alternative providers, this is great. My mom had the cold laser, so you're stimulating the scar tissue to heal with light therapy. So that was really helpful when we couldn't really touch her with the blood clot. Chinese medicine, acupuncture, energy flow, pulse electromagnetic current on the top right-hand corner. Here you see that coil. Reiki, meditation, that's really powerful in hospice care, relaxing the person and using reflexology, mapping out the organs underneath the foot and doing a little bit of reflexology there. Sound healing, sound vibration is really, really powerful. It helps relax people. Our seniors really like that. Red light therapy, blue light therapy. We're always in front of that blue light. And so really helpful with really minimizing for seniors the amount of blue light they're being exposed to because it creates brain inflammation, brain on fire. Sleep oxygen, we follow the oxygen in our office. It doesn't matter what diet you are on. If you don't have proper oxygenation, you still have fuel. I don't care what diet you're on. You need to check that. That's important. So, highlighting common most complaints. This we talked about with the spine here. Falls we've addressed. Balance, digestion, elimination, exercise safety, assistive devices, drug management. A lot of people come in with overwhelm. I saw one patient. He had 3 different medications for the same thing because he had been to 3 different providers. So kind of really watching that because there was a lot of inflammation that he was going through. The 10 most common chronic conditions for adults 65 and over. Hypertension. This is all inflammation. I don't care what you want to say. This is all inflammation and can be managed. And getting into the right team is really important. Just remember, only 11% of the population uses chiropractic care, and of that 11%, we're seeing 20%, 15%, 20% of our seniors take off and use it because it's really beneficial. So it's pretty rad. Know your team. Again, functional MDs, you can have regular MDs and you can have functional MDs. Understand that functional MDs work really well with what we're doing because they understand our language, they understand our labs. Concierge medicine, easier because you're able to ask the doctor over and over again questions or any clarification. That's a really good model. I really like telemedicine. Seniors don't like it. They actually want to come and see you in the flesh. Really good for the caregivers or the children to be able to go into a health record and see my mom's file so that what she was telling me was the same as to what was going on in that medical record. But I have that background. So it's like something that, I know that language, I know labs. I was trying to marry it together, but that's also really nice to see when you're caregiving your parent from a distance. Find your team that's medically curious. I have limitations. I send out when I have limitations. I need collaboration. And then also call that doctor. Say, hey, what type of therapy? This is my mom. This is what I need. Are you a right fit? Anyone can do a discovery call. Lisa fields calls like that all the time to make sure we're not wasting and we're protecting everyone's time, energy, and money. Healthcare costs right here. Chiropractic associated with lower Medicare costs. Woohoo! $83.5 million in savings annually. More visits to doctors and chiropractors, fewer visits to primary care medical physicians. So that's pretty cool. I like that. This is a review right here. If you sign up and you want the notes for this seminar, please make sure you visit us at our table over there because I can give you this because I know it's a lot of information. Writing therapist is my research here to support some of the things that I've been talking about today. Kind of new, I have a big brain protector for my seniors. There's a lot of new research that's showing that statins, lowering cholesterol, we're lowering it too far, and we're seeing a rise in rehab, brain rehab. A lot of people are having dementia, so it's a conversation that a lot of functional cardiologists are starting to talk to me about, concerned about. Alzheimer's disease, risk 50 to 80% higher in adults who have caught COVID, inflammation, brain on fire, okay? So white matter lesions suggested with ALS, they actually had celiac disease, gluten intolerance, and then the ALS. It's really interesting. So, that's influence of food, and just knowing that somebody had a allergy. Relationship of sex to diabetes, risk in statin trials, risk of dementia related to no physical activity. Okay. Brain vitamin D forms cognitive decline and neuropathy in communities dwelling, just like not having basic vitamin D. You need to have light to convert your cholesterol into vitamin D. What do we do at wintertime? We're not out in light, so cholesterol goes up. So just basic things that, you guys get it. So I was asked to, Arlene's going to come up. She's a dear friend and patient of mine. And I thought this was really interesting. She mentioned a 36-hour day. It's a book and reference. I think that whenever we're going through caregiving somebody that we love, we feel really alone, and we just need to have sometimes references to kind of like go, okay, somebody else has gone through this. This is how they approach it, and it feels a little bit nurturing to have resources that we can go to. And this book, I'm assuming, really helped. And these are other reference books that she recommended when she was going through caregiving. Her beloved husband died. This is beautiful Arlene, and so we're just gonna have her sit here. We're gonna go over some Q&A with her because she was an amazing caregiver, somebody that I admired when I watched her take care of her husband's son. So give her a warm welcome. Okay, so I'm used to having a slide now. Whoa, here we go. So I wanted to ask you 5 questions. I know we've talked about them a little bit before, but what was the most surprising aspect of you taking care of your husband who suffering from dementia?
I was really surprised at how hard it was. I'm pretty good. I raised 5 kids, and I thought, I could do this. But it was really hard, and I needed a lot of support. Costa's been just wonderful. We've known each other for years, and she just made all the difference. I do not think I'd still be here if she hadn't helped me along, really. But I also found I needed a team. People were so important, and I needed to like my doctors, and I needed them to hear me because I was advocating to my husband who could not do much of anything. So he was sick a lot of years. It takes a toll, and you don't get to take self-care because at 36-hour day it doesn't exist. You have only so many hours to get him to the doctor, to take care of him. You're doing all these basic things. And so you need that team. You need an ability to get some self-care, because if not, at the end, as they leave, you're in terrible shape, physically and emotionally. And it's taken a toll on you. They say the body keeps count, but it doesn't take care of it. So I found that I needed, and this is me personally, of course I needed medical that I could be supported on. I used counseling and my minister, and praise God on the beach. But I found that I needed somebody that was a professional that could support my emotional, because there's so many emotions. One day you feel so bad for this person, and the next day you're so angry you wish they were gone. You find yourself not liking them, and then it's hard to get care. But that's all natural, because you're being pulled through this grief of loss. At the same time, you're still supposed to be doing things, taking care of. You're still supposed to keep the house up. You're still supposed to keep meals. And you're still supposed to take care of somebody that can get in a lot of trouble if you don't watch. And my husband would get in a lot of trouble.
Actually, he liked to get into trouble, I think, before he had dementia.
I was going to say he was good at it when he didn't have to. Only he upped the game.
So your suggestions for a caregiver, what would you recommend, like, for other caregivers that are in your situation?
I would suggest get your teams, whatever you need, and make sure you're supported, and try not to miss your health appointments. I skipped them, and I had a lot of payback by the time I got to the end. So,
how has it benefited you to use holistic and chiropractic care, not just the traditional model? You've used a bit of both. So tell us how holistic and chiropractic care has helped, and has it made it easier or worse, or what?
I was ill the early years of 20s, 30s, and 40s. I had a lot of lung problems, and I found I was steered through a friend to a MD who was also holistic, and he got me so that I did not have any infections going on. I was in and out of infections all the time, antibiotics didn't help. And he slowly worked with me, both with acupuncture, a holistic, and he is an MD. I then switched over, but I always kept my traditional because you don't know if you're going to be in the hospital, you don't know if you're going to have surgery. So I did a balance, and I'm still doing that. But I am pretty much functional or alternative, whatever you want to call it. But I go there first and work that. If I have to do traditional for something else, then what I do is come back. I have traditional going, come back and talk to Dr. Costa. How can we balance these things that I'm doing here with my nature self? I'm 86 years old. I feel like, okay, some things are going to go wrong. Pieces are going to break off. So they do, even if you're good at it. I've been in an exercise program for 25 years, and it's very active. So all of those things are really important. You have to take care of yourself. And I would suggest for the caregivers, bring in help before you think you need it. Bring it in early. I did not because I was too proud. I thought, I can take care of my own husband. That's my job. And it cost me.
Oh, thank you. What did you learn most about family, people, and friends when you were caring for your husband?
Oh, I got help from a lot of people. I mean, yes, my family is wonderful. They're very supportive, but I kind of had to find out what each could give, Not all of us are tomatoes, some of us are apples, and some of us are celery. And so you're not going to have the same thing from the same people. So when they offered to help, when I was finally accepted, which was way down the hill, Dr. Costa was on me all the time. When I finally brought in help, I was so overwhelmed with the generosity and kindness and caring, and even people that I hardly knew were willing to help. So get good caregivers in to help, whether they're professional, family members, friends, but let people know it's humbling, believe me, and it's hard. But we're not super people, and part of it is we're supposed to hold hands in this life. We're supposed to walk together.
So much great wisdom. The last question that I have, though, is what are some of the challenges you have faced after becoming an elderly person or a senior with the healthcare community?
Not being heard. The invisibility your mom was talking about. That's where you pick your doctors. You say that if I don't like you, I don't want you. I wouldn't have learned that without my husband because he was more of a responsibility. I would do more for him than I would have done for myself. And I found doctors that I liked. Listen. And I still don't have a doctor I don't like. They're gone. Because they are. Because they're not listening to you. You are employing them, so make sure you like them. The other thing is that I have to weigh what the tradition says to me and weigh it against my good sense. So.
Great, thank you. Thank you all for being here. I hope that clarified a little bit about how, holistic and whole body health care, because you guys are the consumer, you're a consumer for your own health, you're caregiving for somebody else, and someday you'll be in that position. There's so much more out there, and it's great. We've come a long way, and we have a young medical doctor here. She wants to know more about holistic care to help understand how when she becomes a primary care physician, what are her resources. So medicine is changing, the traditional model is changing a bit more, and thank you all for coming out.